Today, our topic will be on bilirubin metabolism. Bilirubin metabolism, it begins in red blood cells, or we can say RBCs. And we know that red blood cells, they don't have a nucleus, and also red blood cells, they have hemoglobin, which carries oxygen. Now, this red blood cell, it has a lifespan of 120 days. So as these red blood cells get older, we can say close to 120 days, these red blood cells, they lose their flexibility. So they cannot go through narrow capillaries very efficiently. So they get blocked in the capillaries and then they get broken down. These RBCs, they get broken down by macrophages. So when these macrophages eat up red blood cells, this red blood cell release hemoglobin. We already know that these red blood cells, they have hemoglobin in them. And then this hemoglobin is broken down into heme and globin. We can know from the name hemoglobin, heme and globin. This globin is then converted to amino acids, which is then used later on for other purposes. And this heme, it is broken down into iron. Also, this heme is broken down into biliverdin. Biliverdin, it is like a bit green in color. This heme is broken down into biliverdin by the help of an enzyme, and that enzyme is heme oxygenase. Now, we are interested in bilirubin. So we get bilirubin from this biliverdin. This biliverdin is converted to bilirubin by the help of the enzyme biliverdin reductase. Biliverdin is green in color and bilirubin, it is yellow in color. So once this bilirubin is produced, this bilirubin is released into the bloodstream, into the systemic circulation. This bilirubin in the blood, it gets combined with albumin. So albumin comes and it joins with this bilirubin. Then this bilirubin, which is combined with albumin, it goes to the liver. Why this bilirubin and with albumin goes to the liver? So that it can get conjugated. So this albumin and bilirubin combination, it is an unconjugated bilirubin. So when it is unconjugated, it hates water. It is water hating. So it loves fats or lipids, so it can go easily through the cell membranes. And also this unconjugated bilirubin, it can cross the blood-brain barrier and it can cause serious complications. So that's why we need this bilirubin, unconjugated bilirubin, to get conjugated in the liver. So when this unconjugated bilirubin gets conjugated, then this conjugated bilirubin will become water loving. So it will become water soluble. Why we want this bilirubin to be conjugated? So that it can be easily excreted out of the body, because we need to excrete the excess amount of bilirubin. So in the liver, we have this albumin and bilirubin which are combined together. So we are not interested in albumin. So the albumin gets removed from this bilirubin. So now we have this bilirubin. This bilirubin gets conjugated by the help of the enzyme UDP glucuronyl transferase. Again, the name of this enzyme is UDP glucuronyl transferase. So when this bilirubin gets conjugated, like how does this bilirubin gets conjugated? This bilirubin gets conjugated when glucuronic acid is added to it. So that's why we can see that the name is very similar of the enzyme. We have glucuronyl transferase. So glucuronic acid is added to this bilirubin. And now this bilirubin is conjugated. So once this bilirubin is conjugated, then this bilirubin goes into the gallbladder. Now in the gallbladder, this conjugated bilirubin goes with the bile. So in the gallbladder we have the bile and we have the conjugated bilirubin. So when you eat some fatty food, then this fat needs to be emulsified. So bile is released for emulsification. And also we have this conjugated bilirubin released. This conjugated bilirubin, it is being released into the intestine. Now in the intestine, this conjugated bilirubin meets bacteria and other types of enzymes. So then this conjugated bilirubin, it gets converted to urobilinogen. So because of the bacteria in the intestine, this conjugated bilirubin, which is a combination of glucuronic acid and bilirubin, it gets converted to urobilinogen. And later, this urobilinogen gets converted to steatobilin. What is this steatobilin? It is this steatobilin, it gives a brown color to your stool. So when you defecate, you see that the stool is a bit brown in color. It is because of this steatobilin. So from the stool, 85% of the bilirubin, it is being excreted. Now we have other percentage of bilirubin remaining. So how does this get excreted? Well, it can also get excreted through kidneys. So urobilinogen, it can go to the kidneys. So in the kidneys, this urobilinogen, it will get converted to urobilin. And then through the urine, urobilin is excreted. So the urine will have urobilin in it. So that is how bilirubin is excreted, through defecation and through urination. Now, some of urobilinogen, which is still in the bloodstream, then it goes to the liver. So we can see that a cycle has been formed here. Urobilinogen from the bloodstream going to the liver, that is known as enterohepatic circulation. So from the bloodstream going to the liver, it is known as enterohepatic circulation. Now, we produce about 250 to 350 milligrams of bilirubin per day, or roughly we can say 4 milligrams per kg body weight daily. So if you are about 80 kilograms, so we will multiply 80 kilograms by 4 milligrams, and this bilirubin needs to be excreted. So in the bloodstream, the normal bilirubin level is 0.1 to 1.2 milligrams per deciliter. So in your blood, you must have between 0.1 and 1.2 milligrams per deciliter. If the bilirubin level increases, it goes above 1.2, or it goes like we say we have 2 milligrams per deciliter, that is the level of bilirubin in the blood, then we say that it is hyperbilirubinemia. Hyperbilirubinemia. Why? Because the amount of bilirubin in the blood has increased. And when there is a very high increase of bilirubin in the blood, then it can lead to jaundice. So to recap, what we saw is that bilirubin is produced by red blood cells. Red blood cells, they get eaten up by macrophages at about 120 days. Then red blood cells release hemoglobin, and hemoglobin release heme and globin. Then this heme gets converted to biliverdin. This biliverdin gets converted to bilirubin. Then bilirubin is released into the bloodstream, and in the bloodstream, this bilirubin gets combined with albumin, and this albumin and bilirubin, which is unconjugated bilirubin, it goes to the liver to get conjugated, and albumin is removed, and glucuronic acid is added to the bilirubin. So this glucuronic acid and bilirubin, now they are conjugated bilirubin. This conjugated bilirubin is added to the gallbladder with bile, and then this conjugated bilirubin goes to the intestine, and in the intestine, because of the bacteria, this conjugated bilirubin it gets converted to urobilinogen. Then urobilinogen with the presence of oxygen is converted to stecobilin. This stecobilin gives brown color to your stool. So about 85% of bilirubin is excreted through feces. Then the urobilinogen in the intestine, it goes to the bloodstream, and in the bloodstream this urobilinogen goes to the kidneys, and in the kidneys this urobilinogen gets converted to urobilin, and then it is excreted through urine, this urobilin. So in the urine we have this urobilin, and some of the urobilinogen which is still in the blood, it goes to the liver. So this urobilinogen which goes to the liver, it is known as enterohepatic circulation. And very high amount of bilirubin in the blood can lead to jaundice.